So when I talk about microbiome, you might first think of gut health. That's great because there's a ton of microbiome in your gut. And we take probiotics and everything else to adjust that. That's fantastic. But we have microbiomes in lots of other places in the body. The one I want to talk about today is from a study from 2018, and it's microbiome in prostate inflammation and prostate cancer. So microbiome does play a role in cancer. Some of this is the fact that if you have improper microbiome, so the wrong guys are in there, you have inflammation. Inflammation definitely will spur on cancer. So let me read you the conclusion and kind of help understand how this is coming into play. So the microbiome encourages homeostasis, that's balance, and helps the immune system. In dysbiosis, so that's dysregulation, it's not where you want to be. A systemic inflammatory state may be induced, predisposing remote sites to disease, including cancer. The microbiome's ability to affect systemic hormone levels may also be important, particularly in a disease such as prostate cancer that is duly affected by estrogen and androgen levels. So the androgens are the testosterone, DHT, those things, okay? So your microbiome in your gut, which you probably first thought of whenever I said microbiome, does play a role in the amount of estrogen and androgens that you have circulating, and can make a very big impact on your prostate cancer if it's a hormonally sensitive prostate cancer, which a lot of them are. So microbiome is very critical, very important. And back to the study, due to the complexity of the potential interconnectedness between prostate cancer and the microbiome, it is vital to further explore and understand the relationships that are involved. So you say, okay, well, now what? Well, there's ways of testing that microbiome. There's ways of looking at the gut microbiome. There's ways of monitoring how that may or may not interact with your estrogen, testosterone, DHT, all of those hormones which interplay with your prostate cancer. And we can also look at inflammatory markers. We can also look at microbiome from a pathogenic standpoint. So we can look at the microbiome from a bacterial standpoint, a fungal standpoint, and we can get that directly from the prostate. So we can look at that microbiome directly for an organ such as a prostate and actually help further your prostate cancer outcome and treatment options whenever we take care of that microbiome. So if we take care of the microbiome, we decrease the inflammation, we decrease that kind of burden of inappropriate microflora in any organ, but in this case specifically the prostate, we can help decrease the effects of that cancer. We can help starve that cancer cell because cancer loves to feed on inflammation. Cancer, what I keep seeing time and time again is if there's infection, cancer feeds on it. So if we've got an infection, if we've got bacteria where it should not be, if we've got incorrect microbiome in an organ such as a prostate, we need to correct that imbalance and we need to reset it to a pristine condition so that cancer cell doesn't have anything else to feed on. If it doesn't have anything else to feed on, it's probably not going to grow very fast. So this is the way we're helping male patients with prostate cancer kind of combat the disease from a completely different point of view and get better outcomes on their current therapies that they are currently doing, and watching PSA levels go down at the same time. So if you'd like to know more about this and how we might be able to help you, please fill out the form below and we'll be more than happy to discuss that with you.